choking, we don't see those a whole lot. But most of the times these patients, I think, are able to relieve their own obstruction. They chew on a bone and then they hack it up in the living room or something. So that's a typical scenario that we will see. But we do have these patients that do have choking, and some of these can actually be quite severe. The big thing is if you have a pet that's choking, you do not want to do a blind sweep to the back of the throat whenever they're conscious. That you will get bit a lot of the times. Even if it's not intentional, you're going to get bit. So you have to be very careful. So you don't want to do a blind sweep on a conscious dog. On a conscious dog, there's a couple of different things we can do. The best thing is the Heimlich maneuver. The Heimlich maneuver, if any of you have ever done it before or are familiar with it, it's just similar to like it is in people. The concept is the same. We want to push pressure up under the diaphragm and thrust where the patient will be able to spit whatever it is that is out. And in small dogs and cats, you can do this with them in both hands. You can hold them up and you can do it. Jerry's cooperative, so I'll stand him up and do it kind of like we would with a small dog or a cat. But what you want to do is you want to put your fist or you want to put your hand underneath the rib cage. If you'll feel where your sternum is right here, just go right below that to the very soft spot. That's you put your fist right there, make a fist, put it there, and then you want to do a thrusting motion to try to relieve this obstruction. In small dogs and cats where you're able to manipulate them a little bit or move them around, I also like to be able to turn them upside down. Also try to help, let gravity help us a little bit to try to relieve this obstruction. So I take one hand, and I'm right hand dominant, so I'm going to take my left hand and put it just below the sternum, turn the pet upside down, and you're going to do a thrusting motion like that. I'm pushing down with my right hand or my dominant hand on top, pushing up with my left hand at the level right below the sternum on the diaphragm, together trying to compress my two hands together, okay? And you're not going to hurt your pets by doing this. I mean, you can actually do it pretty violently, especially in your bigger dogs, but your goal is to really generate a lot of pressure in the chest cavity to try to expel whatever is causing the obstruction. So again, take my left hand, make a fist underneath the diaphragm, take my right hand on the back, with them upside down, and then push. You do that several times trying to remove that obstruction. If you do this several attempts and the pet's still choking, they're still unable to breathe effectively, if they're still conscious, I recommend you get them in your car and you get them to the closest emergency facility. The reason is a lot of times these obstructions are partial. They're not completely occluding the airway. So these pets can still breathe. Oftentimes it'll give you plenty of time to get to the closest emergency room. If, however, these patients become unconscious and are unable to breathe at that point, then you can do a blind sweep at the back of the throat. But at that point, we're trying to do a life-saving procedure, and you really don't have a whole lot of time. Still, after they have completely, they're unconscious, you still have probably 5 minutes to get those patients to an emergency room. Now, what if you have a larger dog? You can't obviously pick them up, you can't turn them upside down, etc. Well, there's a couple of different ways to do it. If the dog's still standing and is able to stand up and facilitate you, and they can actually help you out quite a bit, then what you're going to do is you're going to straddle the dog. So straddle the dog, and then I use two hands in this scenario. I use both hands underneath the diaphragm, and I use my shoulder in their back, if they're big enough, okay? Probably 50 pounds or more. And then I do it just like they would do the Heimlich maneuver in people, okay? Most dogs aren't going to let you put them over a dining room chair or anything like that, but you can put your shoulder into their back, put your hands, one fist underneath the diaphragm, the other hand on top, and then you're still going to try to generate all that pressure. And I try to do it almost like a forward thrusting motion. I pull up and kind of go forward, trying to really get that pressure into the chest cavity. So that type of procedure, so your shoulder is going to go into the back to help brace the dog, and then your two hands are going to go under the diaphragm. What if your dog is not standing? They're laying there, or just a 150-pound Mastiff or something like that, and you're unable to do it. The only other thing, and I've not ever seen this done before, but that you could do in theory, is you lay down next to the dog, and I would do that, but you wouldn't be able to see me. So, so you lay down next to the dog in the same position. Push your one hand underneath between the floors on this side. Put your hand underneath between the dog and the floor, and then get behind them and do the same thing while you're laying on your side. Okay. The other thing is if the dog's unable to stand, but they're still conscious enough to sit in a sitting position, they're laying down pretty much, but they're laying on their sternum. You could do the same thing we did with the dog waking up, but you just have to lay down pretty much on the dog to be able to facilitate that pressure. Okay. So those are two other techniques or two other ways you could do it. The principles are all the same as far as generating that pressure to try to expel whatever is there.